Hey there everyone, welcome back to the Anesthesia Training Series. I'm Charlotte Marquis, I'm a board certified veterinary anesthesiologist, and today I will be talking to you about the basics of IV catheter placement in dogs and cats. So there are many reasons why in the hospital or on the clinic floor we're going to put in IV catheters. So I wanted to go through a couple of reasons of why we do that. A couple of ways we can determine what kind of catheter a dog or cat might need, maybe some different situations, which might change that up. And then in the follow-up lecture to this, in a separate video, I'm going to talk about troubleshooting of some of the most common IV catheter problems. So first of all, let's start out right at the top. So why do we put IV catheters in dogs and cats? So there's many different reasons why we might consider doing this, or why your doctor or technician might ask you to help with this. So one would be something like drug delivery. So this could be anything, right? This could be sedation, pain relief, anesthetics, things like that. So drugs and therapies that the animal needs either to become sedate, become anesthetized, or to be having medical therapy in the hospital. Fluids, so any type of fluids. This could be plasma-light IV fluids like in the ICU. It could be blood products, transfusions, things like that. Blood pressure support. So if an animal has low blood pressure, or in the rare case where they have high blood pressure, we need ways to be able to provide drugs and medicines to be able to change that blood pressure. So we need vascular access or an IV catheter in order to do that kind of thing. CPR. Now, this one's kind of sad, but one of the basics of CPR is having vascular access or having access to the circulation so that you can hopefully get those things back. So having a patent IV catheter is imperative for CPR. And anytime you have a patient that is yes to CPR or the owner wants that, even if the animal doesn't need drugs or fluids now, you should still put in a catheter. That way you have it, you don't have to worry about it. Sedation and GA, we kind of talked about this with drugs, right? But if you have an animal that's getting sedated, you don't want to go back later and say, oh, the sedation wasn't enough and I don't have a catheter, so now I have to kind of mess around and find a vessel. And if you're doing general anesthesia, you need a catheter not only for the purposes of delivering drugs and CPR, but if you're going to intubate an animal and the airway isn't relaxed enough, you're going to need to give more drugs and you just need to have vascular access. So those are just some of the most common reasons we place catheters. I'm sure there's others, but by far and away, that's them. So when we're thinking about catheters, you can think about different locations and types that animals might need, right? So we have tons of options in the domestic dog and cat for this. The location depends on your preference, maybe the patient's medical condition, and we'll go on to talk a little bit more about that later. And then how easy it is to get that vessel. So, if you have an animal that has like very loose, wrinkly skin, like a Shar Pei or a bulldog, maybe doing a hind leg catheter is kind of tough, but the front leg is a little bit easier. Or if you have an animal that is uncomfortable and it just wants to sit down, maybe doing something on the hind leg is not going to be possible, but if the front legs are out, that's a great option. So where can I throw this in? So we have cephalic vessels, we have the main and the accessory. So in the domestic dog and cat, the cephalic vessel runs along the front of both of the front limbs, just above the carpus or the knee. And then the accessory is just beneath that. It is kind of running diagonally into the cephalic and then travels up the dog or cat. So we have both the main and the accessory on both of the front legs. So right there you have 1, 2, 3, 4 options easily. The saphenous vessels. So we have both a medial and a lateral saphenous. So if you had your dog or cat facing to the side, right above their hock on their hind leg, there's usually a diagonal little vessel traveling on the outside of the leg. That's lateral saphenous. And if your dog or cat were lying on their side or standing up, on the inside of the hind leg, just kind of on the inside of the hock or the knee, you're going to see a vessel running down the middle there. And that is the medial saphenous. So if you have a medial and a lateral, and you have that on both your hind legs, you have about 4 options there. So already between the front and the back legs, we have at least 8 places we can put catheters. But wait, there's more. The dorsal pedal. So on top of most dog feet, they're much easier to see. So it usually looks like a V or like a fork, and they travel on top of the surface of the paw before you get to something like the accessory or the cephalic. So this is a great option in a dog that's really big. Cats do have these. They're just very small to see, kind of difficult to hit. So certainly in a big dog, that would be a really great option. And you have 4 feet most of the time. So you have at least 4 options there. Jugulars. So jugulars are vessels too, right? We don't often think about them until we get to things like central lines or jugular blood draws. But if you have a patient with really bad peripheral vessels, or maybe it has horrific orthopedic disease and it will not tolerate you pulling that leg out, the jugular is an option, both for temporary and long stay catheters like jugular and central line catheters. So most dogs will have 2 jugulars unless they've been ligated. So on a basic level, if you were just to use like one side per leg, you have at least 10 options. There are certainly more vessels. Just go to the vessel you can find and you feel that you can hit easily. That is what I would recommend. So lots of people ask, how do I pick an appropriate catheter for my dog or cat? Is it going to be too big, too small? What length should it be? Like, does that matter for the animal's condition? And yes, it does, but no, it also doesn't matter. And I'll go on to describe a little bit of how I feel about that in a couple of bullet points here. So generally speaking, we have short and long length catheters, and most of them in the United States and Great Britain are color-coded. So when I think about short versus long catheters, I'm going to hold up 2 of the same gauge here, but they're different lengths. So I have a short catheter here. This is a short 20 gauge, and I have a long 20 gauge here. So usually your short catheters are just over 1 inch or 1.25 inches, and then you have long catheters, which may be 1.8, 1.88, or 2 inches. So just so you can see the difference there. And then we also have even longer catheters. So both of those were 20s. This is a 14 gauge, so this is a much bigger catheter. And this one happens to be about 5 1/3 inch long. So this is mostly used for horses or for very, very big dogs. So just so you know, there is a variety of sizes you can choose. So when would you put a short catheter in a dog or cat? Well, it stands to reason if they have short legs. So if you have a tiny little dachshund or a cat which has a very short distance from the carpus to the elbow, then a short catheter is going to be what you want in them. Because if you have something so small, the length of their forearm or forelimb is only going to be maybe this long. You probably don't want to put something like this into your small dog or cat. The dehydrated and the dying. So you might say, why is that important, or what does that mean? And here's why this matters so much. So when we think about these 2 catheters, we have a short and we have a long. Each of these catheters usually have a milliliter amount written on them, like how many mils per minute can flow through this catheter at maximum capacity. And the shorter catheter is going to allow liquids and drugs to flow through faster. And the reason why putting short catheters in the dehydrated and dying, or in your GDVs, if you've ever heard that, is that you're going to be able to get drugs, medications, and fluids in faster. And this can make a difference in a really debilitated animal. So if you have something that's bleeding, if it's really sick, if it's a GDV, if it's dehydrated or dying, shorts, not long catheters. Cats, so cats have short legs. That would also be a great example of why you might need a short catheter. Long catheters. So most of your stable patients, that would be totally fine. Stable big dogs. Doesn't really matter if you have a long versus a short catheter. So you can throw one in there just for practice. They are a bit harder to feed just because you have to allow that catheter to go off the stylet, and it does take a little longer than a short one, but it's just a good skill to have. A tough stick patient or a difficult IV catheter placement. So if you have an animal where either the skin was really tough or it has been tough to get into the vein, I would recommend placing a long catheter. The reason why I say this is because it is harder to pull out a long catheter. So if the animal was difficult to get the catheter in the first place, you kind of want to make sure that whatever you get in there is going to stay. And there's considerably more distance to remove from the patient with this one, which is 2 inches long, versus this one, which is only 1 inch. So definitely think about that in your animals that have been uncooperative or keep standing up and like ripping out their catheters. So how do I pick a catheter size? So I talked a little bit earlier about how they're color coded. So in the United States, we have several different sizes here. We have a 26 gauge, which is purple. I don't have her today. I have a 24, which is yellow, a 22, which is blue. And people will often ask you for a blue catheter, so that's what that means. If they ask for blue, they want a 22. 20 gauge, which are pink. They also make them short and long when they get to this gauge. 18s, which are green. You can have them short or long, so you can have this one, which is 1 1/4, or you can have a long one, which is like 1.8 or 2. And then we also have like big catheters. So we have things like a 16 gauge, we have 14 gauge. So this one is a 16 long. See how it has like this extra length here. And then we have a 14 gauge, which mostly these are for large animals. So these are going to be greater than 5. So what does that number mean? So what I want you to remember is the smaller the number, the larger the bore. And the larger the bore, the larger the delivery. So what that means is that let's pick up 2 catheters to compare here. So they're the same length, which is great, but we have 2 different gauges. So we have a 24 and we have a 20. So the smaller the bore, the smaller the number, the larger the bore. So a 20 is a smaller number than 24, but this has a larger bore. It has a larger opening. It's going to be easier to deliver drugs and fluids through this. So if I have a patient that is sick, dehydrated, dying, or just have a bigger animal, I'm going to pick a smaller number. So you would transition from things like colors like pink and green and gray for big animals, and then thinking about catheters that are blue or yellow or purple for your small ones. So this is just my rough guide for some recommendations about catheter sizes. At the end of the day, don't try to be a hero with the catheter size. You get in what you get in. Like, I've put 22 gauges in really big dogs. I've also put 18s in cats. Like, it really just depends on how the vessel looks. And it's better to have some vascular access than none at all, because you tried to get a really big catheter in a small animal and then you blew the vessel. So don't try to be a hero. Just try to get one in. Really, at the end of the day, as long as you have a catheter, that is what matters, right? So let's talk about a couple of the different steps we can do to place an IV catheter and how to make sure that is nice and secure. In the follow-up lecture, I'm going to talk a little bit about advanced techniques, or when the going gets tough, like how you can manage that. But here is how I manage this on the clinic floor, or what I end up doing. So number 1, get a buffet of IV catheters. So look at your dog or cat, look at their leg conformation, just assess the situation. And what I want you to do is get 50% more catheters than you think you need. So if 1 catheter goes in the dog or cat, get 2 or 3 others, and maybe get more than 1 size, because maybe you'll try one, it didn't feed that well, and you need a smaller size. So get multiple options. Step 2 is make sure the patient is cooperative. So use manual restraint, get someone you trust to restrain their dog or cat appropriately. You want to make sure that the animal's nice and relaxed, and that's going to make your placement easier and make the animal's experience much more pleasant. But the other thing is a safety issue, right? You don't want to try to get into the vessel and then the leg moves, you've lost your catheter, or that animal tries to bite you or your assistant. That wouldn't be fair to anyone. So if that means manual restraint with 1 person or 2 people, that's awesome. If you can't get that done, do not be afraid of sedation. You can try oral medications, you can try injectables, but make sure that the patient is compliant enough so that you can get your job done. So don't be afraid of chemical restraint in those animals that are aggressive or fearful. My step 3 is shave the leg the length of the catheter. So that's just a rough guide. But if you have a catheter that's, an inch long, I would shave at least a 1-inch square off of the leg. You just have to shave in the area where you're going to try to phlebotomize or poke the vessel. You do not have to shave all the way around the leg, although certainly in some practices that is done. So it doesn't make the catheter more clean. It doesn't necessarily make the tape stick better. Just shave a square and prep that appropriately. Let's see here. So for prepping it, prep with chlorhexidine or a similar disinfectant and alcohol. The reason why the alcohol is really important is because it makes the skin less greasy and oily, and especially with like big dogs or dogs that are intact, if the skin is oily or dirty, the tape is not going to stick and then your catheter falls out. And the other thing I'll recommend is don't scrub the site, just wipe it. You can still get it clean without like irritating the skin. After you've prepped the skin, make sure that you dry it, because if it's not dry, it'll have the same effect as if the skin were unclean. The tape will not stick, your catheter's going to fall out. So now that you've prepped the skin, like, what are we going to do? We're actually going to get our catheter and get into the vessel. So enter the vessel at a 45-degree angle, and then once you get a flash through the catheter, then kind of level it out. The reason why you want to enter at a steeper angle and then level out is because if you go level with the vessel to start, usually your catheter will shear, and that will lead to something called burring, and your catheter will feed into the jawbone cat. Not only is that painful for them, but it's frustrating for you because then you can't get what you want done. So once you've slid the catheter into the vessel, go ahead and put some gauze or a paper towel underneath the catheter. That way, when you pull out the stylet, it doesn't bleed onto the patient. You can just wipe that up. Blood not only prevents the tape from sticking, but also it's a great way to grow bacteria. So you want to make sure you have a way just to clean that up. So you can prep your animal with chlorhexidine. You can wipe them down with alcohol or peroxide, and then drying them with something like a cotton ball or a gauze would be absolutely fine. And then once you've done that, you're going to go ahead and slide out your stylet and attach your T-port. There are a couple different types of T-ports. So you have slip tips and lure locks. So slip tips just kind of have like a rounded edge that you slip into the catheter, and it's really just the slipping in which secures it. And you also have things like lure locks, which is what I have here. So with the lure lock, it looks kind of like a jar lid, so it has spirals on it, and it spirals into the little catheter and it screws on. By their very nature, lure locks are going to be more secure. So if you have concerns about catheters falling out, I would definitely recommend investing in lure locks. But there are ways in which you can make both types of T-ports secure and insecure. So you attach your T-port and get that screwed on or slipped in, and then you have to tape your catheter and secure it. So tape, wrap, label. And what I mean by that is you're going to have to tear a couple pieces of tape in order to get the catheter to stick to the animal. And tape, I feel like, is one of those things that's hotly debated. Some people use X number of pieces of tape. Some people use certain types of tape. Really, at the end of the day, don't try to be a hero with it. It really just needs to be secure. Me personally, I don't care how you tape it. As long as the catheter is secure and patent, it doesn't matter to me. Here's how I tape catheters. It doesn't mean it's correct. It's just one way to do it. So the way I tape catheters is that if I start with a big piece like this, I'm going to split it into 3. So I'm going to create 2 skinny pieces. So I have one skinny piece, and then I have a second skinny piece, and now I've left with this bigger one. So something that I do with tape, and this makes it easier when you pull out the catheter, is I do something called I tab it. So you notice that I folded that bit under, and that part, because it's under, does not stick. And that's a good thing, because that's the end of the tape that we're going to pull off when the catheter's ready to come out. Of course, you can just cut it with scissors, but if you're lazy like me, this is a great option. My big piece of tape I'm going to notch, and the reason why I notch this is because when we're taping catheters, and I'll show you this later in a video, is that this has to slide under to secure it. So that's why it's notched. So I have a notched piece. I'm going to take my other skinny piece and I'm going to tab that as well. And I'm going to do that to my last piece too. Like I said, not mandatory. It's just one of those things which makes it helpful. So I have my tape. I like to vet wrap catheters. The reason why I like to do this is because the vet wrap helps to waterproof the catheter in the event that the animal vomits, regurgitates, is peeing in the kennel, or like the fluid line becomes disconnected. This is just a great way to help protect your tape and buy you a little bit of time until you can replace that and get to it if you're really busy doing treatments. The other thing is that it helps secure the catheter, and I'll talk a bit more about that, but you can notch it or you can wrap it around, and it just helps it lie nice and straight. Something that's really important to remember about vet wrap is that it tightens over time, so definitely only do it finger tight, make it just kind of lie on the animal, and over time it'll kind of shrink down, but please do not just work on the vet wrap and squish it, because it's a very good way to get the paw to be fat. And something that I like to do with my tape, which I'll talk about later, is I alternate the direction of the tape. So if you put your first piece on going to the left, put your next one on to the right. And the net effect is that if one is going left and one is going right, your catheter stays right in the middle. So those are just a couple of things I do. And this is when it gets easy, and sometimes it's really tough. But the important thing to remember is that you don't necessarily have to be a hero. You just have to go for the vessel and see what you get. And that's it.